Growth hormone deficiency is probably fairly common. This might be an estimate, and there's estimated to be 50,000 adults with growth hormone deficiency in the United States that have already been diagnosed. My guess is only about 10% of people have been diagnosed. There's probably about 90% of the people out there that also have growth hormone deficiency that haven't been diagnosed. There's probably about 90% of the people out there that also have growth hormone deficiency that haven't been diagnosed. There's probably about 90% of the people out there that also have growth hormone deficiency that haven't been diagnosed.
Hi everyone, Jane here. I would love to promote this video recently uploaded by Dr. Theodore Friedman. I promoted another video that he did on chronic fatigue and fibromyalgia a little ways back, but the guy is a maverick. He's in a genius sort of way. And so, fibromyalgia people, please listen up. And there was something interesting that hit my radar that I'll point out in a minute in regard to nutrition and maybe veganism, which I've been talking about recent. But here's a screenshot of the video, and I'll leave links to everything. And he goes through what we will discuss is causes of growth hormone deficiency, and take note how Dr. Friedman differs from other endocrinologists with regard to growth hormone deficiency. And this is what gives him the cut above. And I will include a clip of him talking about that. He's brilliant. And, please, people, take note because it's serious. He talks about who should be tested, what tests are available. The only thing I could add to that, he mentions a macrolin stimulation test, and that's new to me. It's a new kind of test. He mentions a glucagon stimulation test, and I was diagnosed. This is the only thing I have to add is I was diagnosed with a clonidine stimulation test. And they're pretty much, another one would be an insulin tolerance test, and they're phasing that out. It's just really hard on the patient. And then he gets into how to interpret the tests and the risks and benefits of growth hormone replacement. He talks about the causes of hypopituitarism, and feel free to pause it at any time. I'm not going to read through every word of it. You could listen up to him because he is the expert and he fills in all the blanks I'm not able to. But this was really the heads up for me. This was new to me. It's the first I've heard it discussed, is malnutrition and critical illness can cause hypopituitarism, and that includes the growth hormone. So it kind of lines up with another video I did talking about oxytocin, and Hot for Health had brought that up, and looking into it a little bit, oxytocin can be not produced correctly from eating disorders. So I'll leave it at that. And then there's more causes of it. And he also mentions too in it, well, you'll hear it in the clip, but people without a direct cause of hypopit can't be growth hormone insufficient. And, heads up, folks, I was one of those. I had a history of Cushing syndrome, but that doesn't make the list. Unless, you're going to say I was on steroids, but I wasn't. I mean, it was, um, you know, endogenously made steroids. Here's some of the symptoms he talks about. Um, and this is just grazing the tip of the iceberg, in my opinion, from experience. And some of it um, gets into the fibromyalgia and weakness and fatigue with the muscle wasting. You're prone to osteoporosis, dyslipidemia. I'll just comment on the cardiovascular disease. It started out with a few heart palpitations, and then I would have a racing heart. And when I was very sick with it, I mean, my heart rate would go to 140 getting out of bed to use the bathroom. I mean, it was an extreme instance of being really sick from it, but it progressed into that. Um, Impaired psychological well-being, such as isolation, anxiety, and depression. Well, your brain shuts down. Yeah, I had trouble thinking my way out of a paper bag. Illness is very isolating, and then it just kind of feeds on itself. One thing that's not on here I would like to mention, and I think it's a contributor to malnutrition from illness, is that my um, GI tract, the motility of it really slowed down, so then I was lost my appetite, had trouble eating properly. So that is one I wish it made the list, but just I had a lot of trouble eating from the slow motility, and I would get stay too full feeling, which would eventually turn into nausea, so that was no fun at all. But I will do a few slides and another clip, and really highly recommend anybody and everybody that's interested to watch the whole video. It's really cutting edge, important video. And again, I don't want to beat it to death, but with that malnutrition issue, um, heads up to people having a eating disorder, and my whole theory about how um, um, nutrition plays a very important role in keeping your hormones working well. Okay, have a great day.
Okay, so this slide I sort of alluded to before, but I think this is interesting. The rest of the endocrinologists in the world over here, they believe that growth hormone deficiency is rare. Idiopathic, which means without a clear-cut cause of growth hormone deficiency, does not exist. Only if a patient had prior surgery or radiation or maybe severe head trauma should you look for it. Only severe cases of growth hormone deficiency should be treated, and you should also only treat growth hormone deficiency if the patient has other pituitary hormone deficiencies. My view is, in general in medicine, you get a history and physical. If the patient has a constellation of symptoms, you try to look for the diagnosis. Growth hormone deficiency is not that rare and explains symptoms in a selected number of patients. And I have also found most patients with both mild growth hormone deficiency and severe growth hormone deficiency treatment get better with treatment. And my view is that this is known as growth hormone is the first hormone deficiency in the current case of hyperpituitarism. So you don't have to wait till other pituitary cells are affected. About 60% of the cells of the pituitary are somatotropes and make growth hormone. The pituitary insert can be mild to give growth hormone deficiency alone and not affect the other hormones. You don't need the other pituitary hormones to be deficient to have growth hormone deficiency. And conditions such as Empty-Sella, Sheehan syndrome, and traumatic brain injuries are not that uncommon and can give you easily growth hormone deficiency. And you might not know it, certainly with the Empty-Sella. You wouldn't know it unless you did the imaging test. So the person may have growth hormone deficiency and have a reason for it. They just may not know about it. probably about 90% of the people out there that also have growth hormone deficiency that haven't been diagnosed. Probably about 90% of the people out there that also have growth hormone deficiency that haven't been diagnosed.